Hello and welcome to another Health Essentials podcast. I'm John Horton, your host. Why would anyone willingly be stuck with needles? As it turns out, there are lots of reasons, which explains why acupuncture has been around for 3,000 plus years. This ancient practice is routinely used as a supplemental therapy to address chronic pain and various other health issues. But how exactly does a needle prick relieve pain? We're going to explore that concept today with licensed acupuncturist Tim Sobo. He is one of the many experts at Cleveland Clinic who visit us weekly to help demystify medicine. So with that, let's learn about the positive points of acupuncture. Welcome back to the podcast, Tim. We always appreciate repeat customers.
Well, thank you for having me very much. Looking forward to our conversation today.
Yeah, and you're here with us today to talk about acupuncture. And I understand you kind of got interested in this form of treatment after experiencing what it can do while recovering from an injury. Can you kind of share that story?
Yeah, to make a long story short, I was in college training for a Taekwondo tournament, and I tore my meniscus in my right knee in three places.
That does not sound good.
It was not fun. That ended my Taekwondo competition days pretty much right there on the floor. So after that injury, I, got my MRI, did all of the standard, conventional medicine, and following the knee surgery and the physical therapy, my knee was more or less the same as far as pain goes and function. I knew a little bit about acupuncture just through my own personal interest in, martial arts and that kind of things. I tried it as a patient. It worked very well for me. Fast forward, finished college, off to grad school. Here I am in my 13th year of clinical practice, I think, right now.
Yeah. Well, so you actually, sounds like a little desperation kind of took you over to it. And
yeah. So, the pain in my knee wasn't like excruciating, but it was constant, dull, nagging, hard to go up and down stairs. I couldn't jump very well. I was like, all right, well, what else can I try? And I tried it, and holy cow, it worked really well. And, after I finished college, I was like, all right, this is now kind of what I want to look into doing. And then I went to grad school, have my master's in acupuncture. I've been doing it ever since.
Wow. Well, I'll tell you, that's a great story to try to convince people, hey, this is something to look at. So
yeah, it does work.
All right. Well, let's dive into this, and let's kind of start with the basics. And that's just kind of, what is acupuncture? And just how does this work?
Yeah, so there's kind of two answers to that question. The first one is the answer that's entirely in traditional Chinese medicine terms about energy through your body, yin, yang, various organs, and all of those answers. And then there's the physiologically, what happens when I put a needle in here.
All right. Well, let's start with the energy one, because that's always a little fascinating. So what's going on there?
Yeah, so in Chinese medicine, that again, we'll keep this broad. It starts with everything is a yin and a yang. And then, you have various systems throughout your body that are in charge of things. So if you go to traditional Chinese medicine or acupuncture and they say something like you have liver qi stagnation or kidney yin deficiency or things like that, first you have to remember they're not talking about like biologically your organ. So your kidney is fine, your liver is fine. That's not what they mean. They mean these energetic principles and kind of the function that they have inside their body. And acupuncture goal is to get those to work in balance together. Everything in TCM is a pattern unto itself. This organ or this energy is an excess. This one's in a deficiency in relationship to it. So this causes your health problem. We want to make them all level and balanced out.
Okay. So the idea is you put these needles in and it kind of redirects the energy where it needs to go.
And it redirects your body's energy flow. Like, it's not flowing through this channel, this meridian correctly. Let's work on, breaking through that barrier, that dam, so your energy flows smoother. That would be like your stagnation patterns.
All right. So it's like little traffic cops that you're putting in. All right.
And other ones are, it's not moving through this one fast enough. That's your deficiency. Let's traffic cop that along and move people through that highway a little bit quicker.
All right. So that's the traditional kind of energy, that whole thing. So what about
energy pathway, energy sense, getting your body back to that balance between yin and yang, which is great and it's cool. It's a great conversation to have, but it's very hard to have that conversation with a person who doesn't have a background in Chinese medicine and, or Chinese, theory or Chinese philosophy about yin and yang. You go into an orthopedic surgeon's office and say, hey, your patient has stomach chi deficiency. It's not going to mean anything to them.
It doesn't say a lot for your knee, right? It's
exactly. So physiologically, what happens when needles go in? Lots of different things happen. So I always like to use my arm as the example just because I can touch it. So when I'm talking to patients, they can see it. So you get a needle that goes in locally right here.
Okay, right here, and you're pointing at because we have some people who are listening.
I'm just picking a random spot on my arm.
Anywhere on your arm. All right, needle going in.
This can be treating knee pain, back pain, shoulder pain, digestive problems, whatever you might be treating. When that needle goes in somewhere locally, you get a localized immune system response. Yes, the needles are all single-use, sterile, and disposable, so the needle itself isn't a problem, but your body's immune system is going to want to know, what is this thing now sticking into it?
Yeah.
So you get a local immune system response. So you get an increase of blood supply, you get a vasodilation, you get a histamine response, you get more red and white blood cells going to that area where that needle is. And then I'm going to anthropomorphize the body a little bit too much, but that kind of allows your body to go, oh, look at all this tissue that's injured, inflamed, damaged, whatever it might be. And then it can work on repairing that tissue. Okay. The red blood cells are bringing in your oxygen, your nutrients, and whatever else you need. And your white blood cells are there to take away the dead, damaged, dying cells or any other problems that might be there. And that can allow your body to start to heal that muscle, joint, soft tissue, whatever it might be.
All right. So it sounds like the idea is, you have this injury and you almost injure it more with these little pinpricks.
Yes.
And that's sending more troops in to kind of help the body get better.
Help that out. Yep. That is one of the kind of theories of how acupuncture works. We're introducing new micro traumas to the area to kind of tell your brain that this knee pain you're experiencing is new, not something you've had for years. You should look into this and try to fix it. So that's that immediate, where the needle is going. But then you also have the surrounding area. Obviously the needle is in your knee, your elbow, your back, but it affects more than just that pinpoint area. Pardon the puns. I'm going to be using a lot of them today. You get this effect that goes, an adjacent area, a couple inches up and down and around that. So I always describe it as, here's what your muscle fibers should look like. Flat, smooth, even, all go in the same direction. You get an injury, you get trauma, you get something, and they twist and knot on themselves.
Get out of whack,
This is your muscle knot. This is what you can feel when you're like, oh, what is this thing right here? That's your tissue curling around on itself.
Okay.
And acupuncture needles will go into that, and it can help break that up manually. So think of a massage therapy, you're rubbing on it, trying to force it to do that again. The needle gets to go directly into those fibers and work on it from the inside out, for lack of a better expression.
How many needles get put in? I have visions of somebody just turning into a pincushion. Is this just a couple, or does it vary?
It varies person to person and condition to condition. Broadly speaking, you're looking at 20-ish, depending on the condition. Is it one-sided or both-sided? Is it both knees? Is it just your left knee? Yeah. And then things will also change based on provider preference. Are they a person who's going to do a lot of heavy needle manipulation and they might use less needles? Or are they going to put in, I'm going to put more needles in to kind of get the same effect? But 20 is a good number here or there. Typically, you're not going to get 4, but you're typically also not going to get 40.
Okay.
So 20 is pretty normal. Most commonly, when you see something on in a TV show or a movie and the person's laying down and just covered in needles, that's so it comes up on camera.
Okay. All right. That's what we all have in our mind here. So
yeah. So those who can actually see it.
Yeah.
This needle is about as thick as one human hair.
Wow. That is thin.
And they're bendable and flexible, so you can see I'm bending it and it'll
holy cow,
back
man.
into place.
I can't believe they bend like that.
Yeah, so this is your standard needle. Some of them might be a little bit longer, a little bit thicker, but typically they're about as thick as one human hair.
Okay.
And this one is an inch-long needle.
Okay, I got to be honest, that doesn't look scary.
No, this is the most common,
I don't like needles.
Yeah, this is the most common type of needle.
Okay.
The biggest difference between this and the needle you get your blood drawn with is there's no hole in this needle. It's a
Okay.
filiform needle. So your needle,
Okay.
you get your blood drawn, your flu shot, whatever, is a hypodermic needle. There's a hole in it to introduce medication or to draw out blood. I can fit about 4 or 5 of my needles inside the hole of your standard hypodermic needle to give you
Wow.
just how small these needles really
Yeah.
are.
Okay. Well, and this gets to the one question that I know everybody has, and that is, does this hurt? I mean,
Does
you're
acupuncture
talking about
hurt?
getting stuck with a needle, and that
Yep.
does not sound pleasant to
Yeah.
anybody. I mean,
Anyway,
does it hurt?
That's the first question patients ask. That's the first question I tell people is, does acupuncture hurt? Broadly speaking, no.
Okay.
However,
I knew there was a but coming there.
However, it's still a needle going in. So it may pinch or be uncomfortable, but as far as the uncomfortableness of getting your blood drawn or a flu shot, comparably, it's nothing like that.
Okay.
Most of the time when people say acupuncture is painful, it's the shock that they felt anything. I'll put 4 or 5 needles in, you won't feel a thing, and then, ooh, I felt that one. And it's that sudden pinch out of nowhere that's painful. And that usually goes away in a matter of seconds.
Okay. And the anticipation, because we all know waiting for the needle is the worst part.
So when I see patients, I talk about anything with them. Hey, did you watch the Cavaliers game last night? Did you watch the Guardians last week? Did you see the Browns play this weekend? Any plans for this weekend? Just so they're not thinking about, oh God, there's a needle about to go into my shoulder, foot, back, wherever it might be. And then I put one in and people are like, oh, that was it? That was nothing.
Well, to be honest, when you compare it to the pain of Cleveland sports, any needle is not going to be as bad as what most of that is. But that's a whole other podcast we could do. So these needles, you put them in, you got your 20 needles that you're kind of sticking in around this injured spot.
Yeah, and so needles aren't just going to go where that injury is.
Okay,
so,
around it, yeah.
Yeah, they're going to go in your knee. There'll be some might be in your foot, some might be in your hand. But
they're far away?
They're going to be systemic. They're going to be everywhere in the body. So to go on the last part about how acupuncture works is it also has a systemic effect. So it affects every system in your body. So yes, you had knee pain or back pain or wherever. And yes, the predominant number of needles will be where you hurt. But you'll get some distally. And those are there to kind of help, if you think of your muscle is this long, I'm going to put needles that whole length of it. So your pain might be up here, but it's still this muscle down here. So if your quadricep, your hip all the way down to your knee.
Okay, right.
So we're going to have to treat that whole length. And then you have connective tissue that kind of wraps around your body, and we're going to treat that as well. And that doesn't really start or stop any one particular spot. It's just kind of everywhere. So the imagery I give people is think about when you're making your bed and you just throw all the covers on and there's one part up near the top that's just all twisted on itself.
Always, yeah.
You can go right to it, fix it that way. That's the local needling. Or I can go to the foot of the bed, pull on the sheet a couple of times, and it also resolves that kind of ball of fabric up top. It's that same thing with muscle tissue and connective tissue that's knotted up. I want to stretch it its whole length. So that's not just needles in your shoulder. There might be needles all the way down your arm. That's not just needles in your lower back. It might be at your knee. So that's to stretch that connective tissue out.
Right. But you had mentioned even like if you were like your pain's in your knee, like you may have a needle like in your arm. Yeah.
Yep.
So how do you know where those connections are? I mean, is there a map? Do you have an acupuncture map that's like, pain here, put needle here?
The boring answer is that's what school's for. Like that's what you learn in school. It's like where to put them and why you're putting them there. And they're all to try to elicit a body's healing response. So some of them help your body to release more serotonin, dopamine, and endorphins. So that's a whole body systemic effect. So endorphins are your body's natural painkillers. So acupuncture is helpful for shoulder pain, foot pain, migraine pain, digestive pain, back pain. It doesn't matter because the way your brain handles pain is with an endorphin release.
Okay. And there's a plan, it sounds like, Dolly. You're not just dartboarding on people.
It's not just boom, boom, boom. When we stick the needles. There is a plan that is individualized to every patient, not even just every condition. So you can come in with back pain and your younger, older brother comes in with back pain and you'll be treated differently because your back pain is caused by different things. His is or hers is just muscular. Yours is, more disc related. You have numbness and tingling. He doesn't have numbness and tingling. And all of those kind of HPI, history of present illness, kind of influence what we're going to treat you with, how we're going to do it, and what the approach is going to be.
It's so fascinating. And this kind of gets into, I think, a lot of like why people are so interested in acupuncture, because you hear this and it sounds bizarre. You think like, how are getting a needle in your hand going to help your knee? But it sounds like there's a lot of evidence behind it and a lot of years of this sort of treatment.
Yeah. So acupuncture has, Chinese medicine as a whole has a roughly, 2,500 odd year history of something we can document and go, okay, this is Chinese medicine. And it's just been kind of clinically ongoing since. Acupuncture has been kind of clinically studied in the West since the mid-70s when Nixon reopened trade with China. James Reston was a New York Times reporter on that trip, and he needed emergency appendectomy surgery in China, and they actually used acupuncture in lieu of with modern anesthetics for his surgery. And ever since then, he kind of started writing about acupuncture, and that stimulated generalized American interest in acupuncture. And that was 1975, 74. I don't remember the year offhand.
Yeah. You're a medical guy, not a history guy. So that's all right. Do you find, are there a lot of like just kind of myths and misunderstandings around acupuncture where people just have these things in their head?
Yeah. The biggest one is people who just come and say, oh, I don't believe in acupuncture. And I'm like, you don't have to believe in it to work. Now, does a positive mindset help? Yes.
Always a good thing. Yeah.
Always a good thing. If you come into any therapy and go, this is never going to help me, it's not going to help me at all. Yeah, it's probably not going to help you. Especially something like subjective, like pain. If you're convinced my shoulder's going to hurt no matter what they do, your shoulder's going to hurt. But no, so acupuncture, the biggest misconception is that you need to believe in it to work. Followed up closely by there's no science behind it, like what we would consider modern medical science behind it. Both of those aren't true. You can go online onto PubMed, like, legitimate medical research things, and you can read the acupuncture studies that were done and how they were done and, the blinding they went through and, as rigorous acupuncture studies as they can make them, just like any other kind of Western medical procedure. Those are the two biggest misconceptions.
Okay, so it's not pixie dust. We've kind of established that.
Pixie dust. It's not me just sticking needles in, waving some hands in, saying, hoping that it works. There is definitely a specific approach that is used for every condition. And we just were talking about pain, but acupuncture can treat a whole host of things.
All right. Well, we're going to get to that in a second here, but let's on the pain front, because I know that is the most common use of it. Like, how effective is it? I know you had it, and it sounds like it did wonders for you. Do most people have that sort of experience where it can really just kind of ease that?
Yeah. The unfortunate answer is it depends. So things depend on what condition are we treating, and I'll use back pain again as the example. And we'll stick with Cleveland. If you hurt your back shoveling snow, that has a far better chance of resolving very quickly than, I have spinal stenosis and 4 herniated discs.
Okay.
So
that makes sense.
That's because the underlying physical structure has changed. That doesn't mean acupuncture is not helpful. It just means the conversation changes and becomes goal-oriented. That's not just pain being zero.
It's not going to change your bones, is what it is. It's change some muscle issues.
It's going to change that. Yeah. So the conversation shifts and becomes like, what is your goal of care? What do you want to get out of care? What do you want to end up doing? And obviously the answers always are less pain and more function. And that's very doable with acupuncture. We want to decrease the pain that you're in, whether it's, I'm in a constant pain of a 7 and I can't walk the dog around the block. We want to change that to, I'm in a constant pain of like a 2 or a 3, but I can take the dog for a walk. I can play golf. I can go in the garden. I can sit. I can stand. And my pain is just less and manageable. That's a different treatment outcome than, I hurt my back 2 days ago shoveling snow and it's completely muscular. So it depends on what's being treated, kind of determines the outcome of care.
Okay. So it sounds like for most people, they kind of come in with some sort of injury is when you see
Yeah.
it. They do something like you said, shoveling snow. You tore up your knee,
Yeah.
something along those lines. And obviously, those are two very different things
Very different things. So
Yeah.
it doesn't have to just be an acute injury, but the chronic conditions are those conversations where we want to make your pain less and your function more. And your typical kind of acupuncture treatment will be starting, once a week for 5, 6 weeks, depending on the person. And then we gradually want to make them farther and farther apart. So coming in weekly, then 2 weeks, and once a month, as you're just getting that healing going, feeling better. So you're not coming in to see me every single day or every single week.
Right. So that, like what you just described, that's like if you have more of an injury, like your knee injury, where you're coming in kind of for a treatment plan. Do people come in if they just, like you said, they hurt their back shoveling snow, and maybe it's something that's
Typically, like those kind of acute injuries, they're a much shorter treatment. Like, oh, you hurt your back shoveling snow last week. Come in once or twice a week for 2-3 weeks, and you'll be fine and discharged from care. Okay. Oh, I've had this back pain for years and years. That's going to be I don't want to say a long-term treatment plan where like I'm seeing you over and over again, but it's going to be something where I'm going to treat you when you're in acute and in an acute a lot of pain, and as you're in less pain, treat you less and less often, with hopefully being you have more function, you're taking less medication if you're taking any at all, and you generally feel better. As kind of vague as that sounds, a lot of people when they get started with acupuncture, they're like, oh yeah, my back still hurts, but I'm just so much better with it that they can do more and they're just overall feel better.
Can you get too much acupuncture? I mean, is there a point where you get pricked so much it doesn't work anymore?
I mean, no. You can more or less, I think it's doing too much with acupuncture at one time. And what I mean by that is, let's say you come in complaining of, I have headaches and neck pain and lower back pain, and my right foot hurts, and I have digestive problems, and I have trouble sleeping. All of those things individually, acupuncture can help with. Once you start trying to do them all at once, you kind of get diminishing returns. And what I mean by that is, open up your internet browser and quickly open up 6 different web pages. They're all open, but they're just going to take a little bit longer. If I just treated one and then treated the second one, they'll get better faster. Like, yes, I can treat those 6 things that you mentioned. Let's focus on 1 or 2 of them until they're feeling better. Then we'll treat the other thing you were complaining about and kind of keep doing it that way.
Now, when people have chronic pain, that's that's lasting and lasting and lasting. I mean, do they have acupuncture treatments for just? I mean, can they have them for years? Are you talking?
So the goal is not to be kind of I'm seeing you every week over and over and over again. I have chronic pain patients who I see once every 6 weeks. It's enough to keep their pain at a 2 or a 3, and the occasional Tylenol is all they need now. But before they started acupuncture, they were doing Tylenol every day, and now they're doing it twice a week and acupuncture once every 6 weeks.
Yeah.
That, of course, takes time to get to, but it is definitely an achievable goal.
Well, it seems like it can take the edge off a little bit, and it can just lessen it.
In the beginning, it takes the edge off, and then you kind of get those soft tissue, that muscle to heal better, and that takes more of the edge off. Then you can do more. And then whether you're in physical therapy, now you could do more of that. So then that muscle builds itself stronger, faster. And then we're keeping the inflammation down. And it makes this, this cycle that just you heal faster, you feel better, and you're doing more.
Yeah, it sounds like it's one of the tools in the toolbox that you can use, that people can use to kind of feel better and kind of deal with this.
I mean, that's what I tell people. I never want to, kind of express to a patient that it's acupuncture or something else. This is a tool in the toolkit to get you, the patient, feeling better. Whether it's I need surgery and then I need acupuncture after it, or I need an oral medication and I need acupuncture. It's a tool in the toolkit. It's another thing to try when you're in whether it's pain or you have headaches or you have digestive problems. It's an option to try and use, and ideally it's going to be integrated and synergistically used with whatever you're taking or doing to decrease the need for all of that care. decrease the medication you need to take because you're not quite as symptomatic, which means we can decrease the acupuncture we're doing. And we just make that cycle go.
All right. Now we've kind of been focused on the whole pain management
Yeah.
part of this thing. But I know acupuncture is also used for a whole host of issues. We can just run through some of them. I saw where it can be used for menopause. True or false?
Yeah.
Okay.
So it's not going to stop menopause.
Not
It's
gonna
going
stop,
to ease menopausal symptoms. The most common ones are the hot flashes and night sweats that acupuncture can ease. So again, making up an example, I have 4 a day. Now you have 1 a day. Instead of being I'm soaking wet, you're just kind of moist and damp. And then you make the transition less chaotic, less abrupt, and just make it, a little easier to handle.
Yeah, that's kind of wild because then you're dealing with body hormones. So the acupuncture will even kind of help get those in line.
Get those that changed and goes. Yep, they help So the easy way to help think about acupuncture is its goal in the most basic level is to return your body to homeostasis, keep you balanced. You have too much of this going on, we want to lower it down this way. You have not enough of this going on, we want to raise it up to being here. That's the most kind of easiest way to explain it. It's get your body to be in balance. So the symptoms or any problems you have are within reason and less and less. So menopausal symptoms, migraines, headaches, autoimmune diseases, rheumatoid arthritis being the most common, osteoarthritis problems, nausea, vomiting due to chemotherapy, nausea, vomiting due to pregnancy-induced lower back pain.
Wow.
All of those things are things that I treat on a pretty standard basis here in the office.
I also saw where they had acupuncture could possibly help with infertility. I can't even imagine how that would work, but does it?
It does and it can. Yes is the answer to that question. It is not my area of expertise, but yes, if you look and read the studies of it, acupuncture can help get the hormones of pregnancy in balance again. So irregular periods can be more balanced. So your chances of releasing your egg on time and being fertilized on time go up. Increase kind of uterine blood supply and the strength of uterine walls. So the egg implants better and stays and kind of helps to get your hormones in balance. So it can happen.
Wow. It's amazing to me that putting these sliver needles in can do all of that.
Yeah. It's fascinating. Yeah, it really is.
It's mind blowing to be honest. And I think and you had mentioned this, I just think we need to emphasize it a little bit more too. Like you said, acupuncture is very much of a supplemental therapy. It's not a substitute for a cancer treatment or some sort of digestive treatment.
It's not a substitute for your cancer treatment. It's not going to be a substitute for your hypertensive medication. It's not a substitute for going to your doctor regularly. It's none of those things. It's a tool in the toolkit. So going back to the pain, because it's the easiest one to talk about, hey, I take Tylenol every day. Now I take it every other day. Like that's kind of what the medication change would be. You can get on a lower, less dose. I don't need to take my migraine medication as often because I don't have as many migraines.
Yeah.
To the point of you might not take any anymore. But, I'm not saying, oh, stop taking them now because you're doing acupuncture. No, keep them and use them if you need to. That's fine. Our goal is to decrease the frequency at which you might need to take a pain medication or an abortive migraine medication or things like that.
Now, I know acupuncture is rooted in traditional Chinese medicine, but with all the stuff that we've been talking about, and you keep bringing up anecdotal things where people say, oh, they feel better, they don't have to take as many meds maybe, or the pain goes down. But is there kind of scientific proof that acupuncture does the job?
Yeah, so that's kind of where I was talking before about those hormones, that neurotransmitters that get released, that serotonin, that dopamine, that endorphins. That has come from the modern acupuncture studies. Like, how is acupuncture helping this person in pain? Let's figure it out. And they've done things like fMRI studies, and they see where the part of the brain that lights up during acupuncture is kind of your limbic system and how you help, regulate your emotions and how you manage and deal with pain in different ways. That area of your brain lights up. So, hey, acupuncturists help stimulate that area of your brain. Then they do things like blood draws, where they check to see what hormones are in your blood as it happens. And that's kind of where the science has come two. They've done some research, and then they go, and then it becomes, oh, acupuncture does help release endorphins, so it's good for all these types of pain. Acupuncture does help release serotonin and dopamine, so it is good for anxiety, depression, trouble sleeping, high stress, and all of those things. And it just kind of builds on itself from there.
It's so fascinating. Now, so you hear all this, and it sounds great. Are there certain people who are just ideal candidates to try acupuncture?
I mean, I would say anybody's an ideal candidate. That if you have any kind of medical condition that you're still suffering from, or it's relatively new and you want to explore all your options, it's try it. I mean, I'm not just saying that as an acupuncturist, but like the risks of acupuncture are extremely minimal and the rewards are very high.
Yeah. What are there any risks? I mean, other than, you got those little bitty needles coming in, or
yeah. So there are risks of acupuncture like anything else, but when I'll explain all, and they're very, very mild. So if you go online and, ask Dr. Google that question, you're going to get 4 results that typically come back. 2 of them are extreme examples that are by no means common. They're a huge kind of mistake somewhere happened. And the other 2 are, oh, that makes perfect enough sense because what's going on?
Okay. Well, what are the 2 mistake ones?
Yeah. The first one of those is a pneumothorax, which is where a needle punctures the lungs.
Okay. Wow. That seems like it shouldn't go in that deep.
Yeah. So first of all, to reach the lungs on your average adult person, you're talking a needle almost 3 inches long. And then you have to find a space between the patient's ribs.
Okay.
And then just go straight all the way in.
Okay. So somebody really overshoots to do that.
Yeah. I mean,
okay.
Can that happen? Sure. Does that happen when acupuncture is done correctly? No.
Okay.
For multiple reasons, but we don't use needles that long over the chest cavity. And we have enough knowledge of anatomy let's not go straight in. The other one that doesn't happen again is an infection. Needles are all single use. They're sterile. They're disposable. They're used just on that one patient. The risk of infection with acupuncture is about the same as when you get your teeth cleaned or your blood drawn.
Okay.
It's basically 0, but acupuncture isn't done in a sterile operating room, so there's always the chance of something going wrong. But there's alcohol swabs beforehand, and the needles are all single use.
What are the 2 other ones that you said were kind of like, oh yeah, that makes sense?
They're bleeding and bruising.
Okay, well that's Okay, and obviously not a ton of bleeding.
You're not squirting blood across the room. It's 1 drop of blood, 1 cotton ball, wiped right up. And even if you're on blood thinner medications, it's 2 drops of blood and it stops right away. There's no need for a Band-Aid, no need for gauze. You wouldn't even know you were bleeding unless I tell you, oh, hold on, there's blood on your foot. Don't get up yet.
Okay. All right.
And the other one, bruising, would be like a blood draw bruise.
All right. So if people have just heard those couple things and they're like, all right, I'm still in. What's the process to get acupuncture treatment? I mean, is it something you kind of have to request? You have to seek out? How do you even go about doing it?
So that depends on your insurance. I mean, some insurances will require a referral to acupuncture. Some do, some don't. If you don't, you just pick up the phone, find the acupuncturist and give us a call, and you make the appointment.
Okay. Is there something you should look for when you're looking for an acupuncturist? Because overall, somebody's just like, hey, I've got a bunch of needles. I'll give this a whirl. I take it you want to stay away from.
So every acupuncturist that you're going to find by doing an online search, they're going to be, nationally board certified. It's the NCCAOM. They'll be licensed by whatever state they're in. Those are the big things to look for. And then it becomes what you're being treated for. Like, I deal with a lot of, sports medicine and orthopedics things. If that's what you have, you're going to read my bio and find that out through my training and through my, my blurb about me. If you're like, oh no, I have more menopausal symptoms. There's colleagues at the clinic who, women's health issues are their thing. And you'll go to them instead. Like any other kind of specialist you would find, what you want to get treated will determine who you go see. But the broadest one is make sure they're licensed, make sure they're nationally certified, which are all available, to find online.
All right. Well, I'm guessing that worry about needles or kind of doubt about the effectiveness of acupuncture. You had mentioned the whole that it's, it's some mystical thing. Those are the sort of things that scare people off from giving it a try.
Yeah.
What would you say to anyone who's feeling hesitant about the treatment or kind of thinking about it, but just on the fence?
Yeah. The first thing is, call and have, a conversation with an acupuncturist, and they'll explain why you're, afraid of XYZ or what you're nervous about. And they'll walk you through the process, basically. Most people it's the fear of needles. They hear needle, they think their blood draw, their flu shot, a cortisone injection, something that I want to say hurts, but it's something that is uncomfortable.
We're all a little afraid of it. Yeah, a lot of people.
A lot of people are afraid of a needle going in, and now you're going to tell me I'm going to lay down, you're going to stick, 20-ish of them into me? No thanks, no thanks, no thanks. But once you see what a needle looks like and they walk you through it, most people very quickly go, oh, that's what I was so nervous about? That's no big deal. And they come back and do it again and again.
You do a fabulous sales job on acupuncture and what it might do. So it sounds like if anyone's at that spot where you got this pain, you've got some issue, and just nothing seems to work, give it a shot.
Give it a shot, yeah.
All right. Well, Tim, thank you so much for coming in. This has been, just like I said, an incredible conversation, and one of those things that, man, you're always curious about, and you filled in a lot of answers for people. So thank you very much.
Oh, it was my pleasure. Thank you for having me.
Could inserting thin needles into specific spots on your body relieve pain or help resolve other health issues? There's enough evidence out there to say it might, which sounds like reason enough to give acupuncture a try if you're searching for solutions. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.